Hi, I'm Dr. Matt Stern. We are here at the 22nd annual meeting in Hong Kong of the International Congress of Parkinson's Disease and Movement Disorders, and it's a great pleasure for me to be interviewing Dr. Oscar Gershanik. Pleasure to have you. It's a pleasure to interview you. It's a particular pleasure for me because you and I have been friends for so long and have worked so closely together in this society. But there are things that I don't know about you, and I thought it'd be fun to start from the beginning.
I have many secrets that I can share with you.
Tell me about the formative years. I mean, tell me about your sort of early days of upbringing, and you grew up in Buenos Aires. And
well, I come from a family of immigrants, but immigrants that arrived in Argentina many years ago. My father's family came from Russia in the 1800s, and they were Jewish gauchos. You know, they were people that lived in Russia, had no chance to work the land because they were not allowed to work the land, and Baron Rothschild offered them to have land in America. And so they emigrated to Argentina. They were given a small plot of land and a couple of tools to toil the soil, and they started. And my grandfather started raising cattle. Then he had a butcher shop, had 8 children, all professionals, and they all moved from the countryside, so they were not Jewish gauchos. But my grandfather used to ride horses, wear the typical cowboy dressing of an Argentinian
And just
gaucho.
out of curiosity, where in Russia did he? Was it the Ukraine?
It's actually Ukraine now. It was called Israelovka.
Yeah, so it's very interesting. So you and I actually have very similar backgrounds, because my grandfather also came from the Ukraine and emigrated a little later than your grandfather, but we could have been in the same place. He just went
Actually,
to
my
Argentina.
great-grandfather emigrated to Argentina with several of his brothers and sisters. And from my mother's side is just the opposite. My mother is a mixture of Italian and Spanish ancestry, and from different parts of Italy, from Genoa and from deep south in the Basilicata. And my grandfather from my mother's side, he was a prestigious forensic expert. He was a professor at the university. So my two families have a totally different background. Despite that, they all became professionals and successful
on your grandparents became professionals.
Yeah.
Okay.
Yeah.
So how about you? So you.
Well, I grew up in Buenos Aires. Actually, I wasn't born in Buenos Aires. I was born in the town where my mother was born, which is the second largest city in Argentina, called Rosario. But I moved very early in my life to Buenos Aires. I was just 6 or 8 months old, so I'm a true porteño, as we call in Buenos Aires, people of the port or the harbor. And I went to public school, elementary school. I went to public high school. I went to public university. And it's funny because when I was a high school student, I never thought I would be a doctor. My father was a pediatrician. But I admired my mother's brother, who was an engineer. He was my role model. And I always said I was going to be an engineer. But then, at the last minute, when I had to choose careers after ending high school...
So just to clarify, this was at the end of high school, not college, when you had to decide...
We don't have college.
Right, so high school, you're 18 years old or something.
Yes, right? And you have to decide at that time. You have pre-med courses, but you don't have college in the same sense as in the U.S. And I don't know why. Honestly, I changed completely from engineering to medicine. My father was a pediatrician, and he has his private office in our house. So I was familiar with the comings and goings of the patients, with the kids there, and I saw my father acting as a doctor. He was not an academician, he was a practicing pediatrician. But I decided to go into medicine. But the funny thing is that with my preference for engineering, when I was in second year of medical school, I was offered a teaching assistant, student teaching assistant position in the Department of Anatomy, and I decided to specialize in neuroanatomy. And I had to write a monograph for my apprenticeship as a teaching assistant in the anatomy department.
This is at what point in your education?
Second year medical school.
So just so I understand, so after high school, you're 18 years old, you apply to medical school?
Yes.
So you got accepted to medical school.
Yeah.
And so
I did pre-med. In between, I went for a year to the States, to Iowa, as a high school student. And when I came back, I started medical school.
Okay. And then how did you get interested in neuroscience?
Well, as I told you, I had this interest in engineering, and I thought when I studied biology in my first year as medical student, I thought that the thing that resembled the most the complex circuitry of a machine was the brain. And so that matched my engineering interest with neurobiology. And then I had to write this monograph. And interestingly enough, I wrote a monograph on the complexities of the basal ganglia in second year medical school. At that time, the guy that worked the most in the neurophysiology and the anatomy of the basal ganglia was Rolf Hassler, the German neurosurgeon, and I was fascinated by his drawings and the complexity of the connectivity of the basal ganglia, so I wrote
So this
this
was really
monograph.
this was early in your training.
Second year.
Yeah,
Second
so
year
you're a
medical
medical
school.
student now, and you're getting
Yeah.
connected to the basal ganglia.
Yeah. So it goes back to...
Did you know at that point you wanted to be a neurologist?
Well, I was definitely interested in neurology at that time, and from second year medical school to the fifth year in medical school, I was convinced. There was only one point in my career, late in medical school, where I said, this was almost before the levodopa era, well, there's nothing there for our patients. What should I do as a neurologist? And I said, maybe I should be a neurosurgeon. But my family and myself, we all have essential tremor. So that prevented me from deciding to be a neurosurgeon. So I said, I'm going to be a neurologist. And then there was a second turning point in my career when I was doing my basic training in neurology. I had a very good mentor, an Argentinian neurologist, Alfred Thompson, who trained with Earl Walker, and Derek Denny Brown, who was interested in basal ganglia. And so that got me more interested into the complexities of the basal ganglia. And then in my first Argentine Neurological Society meeting took place in 1975, when I was finishing my training as a neurologist, and my mentor was the chair of that meeting, and he had invited Melvin Yar. And Melvin Yar was supposed to give a lecture on the miracles of Sinemet. You know, carbidopa had just appeared, and combination of decarboxylase inhibitors were just getting into the market, and this was a revolution in the treatment of Parkinson's disease, and he came to Argentina to give a talk. And he had to have simultaneous translation, and so the organizing committee got together Mel Yar with the interpreter, and the interpreter asked Mel Yar, do you have a transcript of your talk? Do you have something written? And he, remember, Mel Yar was not an easygoing guy, and he said, I never write my lectures. And the guy said, I never translate a lecture without having a script. So he resigned. And so my boss said, are you up to the task? I didn't know how to do simultaneous translation, so I said, I can do sequential translation. I can go up on the stage, stand by Mel Yar, and translate what he says. And I did that. And
So now your English
it was good.
was from the 1 year at Iowa at that point?
Well, and I had gone to, in elementary school, I had gone to a bilingual school.
Okay.
And so when I went to Iowa, I already spoke fluently, so I had no problem. And it was funny because there were two things in that lecture, actually three. One, it's a funny one, but the first one is that people thought this had been prearranged because it worked so well that they thought, well, this is the way it was going to be. The second was that Mel Yahr was surprised that I knew so much about the basal ganglia and about levodopa metabolism and all dopaminergic system, and he invited me to go to New York at that time. He said, "Where did you come?"
Were you a resident at that time?
I was finishing my residency.
Okay, end of your residency, planning on that
Planning
point.
on, I didn't know what to do at that time. So this was a serendipitous occurrence that Mel Yahr came to Argentina, and he, after that conference, he invited me to go to New York, and there are some other interesting things after that. But the third aspect, the funny thing is that, as you all know, I'm short. So I've always have tailor-made suits because I cannot find ready-made suits. So I just had a brand new tailor-made suit that my father had bought for me. And I was so nervous that I perspired the whole, there was a drenching sweat that I almost ruined that new suit. But nobody noticed, fortunately. So that was, and then I started all the paperwork to go with Mel Yahr, and he said, well, but before you come to New York, I would like to have a personal interview with you. I will be in Amsterdam for the World Congress of Neurology. Would you come and see me? I was a young guy. I didn't have a cent. And my wife at that time, Patricia Thompson, she had inherited a small sum of money, and she said, well, spend it in your trip to Amsterdam. So I was a young, impressionable guy traveling alone for the first time to a World Congress of Neurology in Amsterdam and having to meet Mel Yahr. And it was funny because I arrived at the hotel, and in the lobby was Mel Yahr, Berkmeyer, Barbeau, Ole Hornikiewicz. I mean, all the big names that I admired.
This is in the mid-70s.
1970 something.
So you're still in the very early days of
early
levodopa, and these are
Oh,
some
yeah,
of the giants in the field at that point.
And there was no movement disorders at that time.
Right.
The subspecialty of movement disorders did not exist. It was Parkinson's disease.
Right.
And so I went there, and I was introduced to all these famous names, and I was really very impressed, and had the chance to talk with Narabayashi, with Barbeau, with Berkmeyer, there was Donald Kahn at that time too, so Ole Hornikiewicz, for me, he was a hero.
Oh.
So I had my interview with Mel Yahr, and he said, well, next year I will have you in Mount Sinai. And so he got a fellowship for me, and we packed our bags and we traveled to New York with my first kid and my wife with a very low salary. I still remember it was around $700 at that time per month. So we had to spend in renting a small apartment in Queens. I didn't spend a single cent in transportation. I walked as much as I could. I ate sausages most of the nights. But I had the chance to work in direct relationship, not with Mel, because Mel at that time, he wasn't accepting fellows to work with him. But I worked with Roger Duvoisin in clinical practice, and with Dick Heikela in basic science. So it was really
Was Margaret Hone there at that point?
No, Margaret Hone was not at that time, but there were many other names that Bill Nicholas was there, Jerry Cohen, who published with Dick Heikela that famous paper, seminal paper on the oxidative stress and the integrity of the nigrostriatal tract. They were very much interested in oxidation and prevention, and from then on, it was like a rolling thing. I spent that time with Mel and Roger Duvoisin. I went back to Argentina.
So how long were you in New York?
I was in New York for 1 year at
Right,
that
and then
time.
went back to Argentina.
Went back to Argentina, and as soon as I got back in Argentina, I received At that time, we had no internet, no email, no WhatsApp, nothing. The most sophisticated machine we had was a typewriter.
Right.
So he sent me a letter, Roger, saying, I'm moving from Mount Sinai to New Jersey. Would you like to come as an associate professor of neurology? I said, yeah. Let's
Hell
go.
yeah.
Oh, yeah. So he invited me, and I had a joint appointment in the Department of Neurology and Neuropharmacology. So I did research and teaching there at the University of New Jersey, and by the end of my stay there...
That was how long?
That was almost 2 years. And Roger told me, would you like to stay? And he said, I have a letter from my representative asking you to stay as a person of interest to the U.S. You know, at that time, if the Congress declared you a person of interest, you didn't have to do any immigration. But my wife and I she was pregnant with our second child, and we looked at each other and said, all our emotional ties are in Argentina. Why would we sever those emotional ties? My parents lived there, my sisters, my wife's brother, and so we decided to return to Argentina, and I'm not disappointed of that decision. I think it was a good thing.
And what did you do when you got back to Argentina?
When I got back, I was invited to stay at the hospital where I trained as a neurologist, and I had an appointment as a staff at the French hospital, and they allowed me to create at that time, that was the early 80s, before the Movement Society was organized, the first section on movement disorders ever in Latin America. And I don't think there were any in the States either at that time, but it's funny because the nomenclature at that time was quite different. We didn't know about movement disorders. It was extrapyramidal disorders. So my section was designated Section on Extrapyramidal Disorders of the Neurology Department. And I started having Tuesday sessions, seeing complex cases and having residents come from different hospitals. And I grew up to become an expert in movement disorders.
And how about, at that point, what was your research? Did you have research interests at that time?
Oh yeah, when I got back, aside from organizing this section on extrapyramidal diseases, I was very much interested in continuing doing translational research, and I applied for a position at the National Institute of Pharmacology at the University of Buenos Aires, and they accepted me. They gave me a small lab, a couple of instruments, and I organized a very modest lab called the Lab of Experimental Parkinsonism. And I started with a first fellow who became later on a very famous molecular scientist in Argentina, Marcelo Rubinstein. He's a brilliant guy. He works now in obesity and the dopaminergic system. And I started doing very modest work in pharmacology. During my stay with Roger, it was funny because when I went to the lab, he said, this is what we do. I give you a month to decide what you want to do. And at that time, it was a recent publication by Kebabian and Kahn on the D1 and the D2 receptor. And that got me hooked on the dopaminergic system and this duality of the D1 and the D2 receptor, and I started designing experiments to try to dissect the relative participation of the D1 and the D2 receptor. I started that in New Jersey, and we got several publications. One was an important one in neurology. And when I got back and started with this very small lab, we started working on the D1 and the D2 receptors. So the other ones were not known at that time.
So here we are now in the late
80s.
70s or early 80s at this point.
Early 80s.
So now the field of movement disorders is just really getting off the ground, and you were certainly one of the, you were there at the beginning.
Yeah.
How did, again, communication we take for granted now. It's so easy. In those days, it wasn't so easy. You're down at the other side of the world. There's no internet. everything's done by mail.
But,
But you were at those early meetings.
well, because another one of these serendipitous or coincidences, I had known Stan Fawn from going to meetings when I was in the States, and I made oral presentations. I still remember my first American Academy of Neurology when I presented data on and this is a funny thing, and if you go to the abstracts of the American Academy of Neurology, you're going to see that I was the first to say that dopa in fact, got decarboxylated in the serotonergic system, and that caused a very aberrant release into the basal ganglia, and there's an abstract to attest to that. And in the audience, there was a very abrasive guy who later on became a very good friend, Eldad Melami.
Right. Who, by the way, I interviewed here a couple of years ago.
And he made my life miserable. I was standing for the first time as a young guy giving an oral presentation on our findings about the decarboxylation of levodopa. That cannot be true, he said. That cannot be true. Levodopa is decarboxylated in the glia or in the vasculature of the basal ganglia. There's no evidence that the serotonergic system can be involved in that. But we had very solid evidence.
Right.
And we had Catherine Mittelinier working in histofluorescence of the dopaminergic and the serotonergic system, and we had very nice photographs of dopamine inside the serotonergic terminals.
And he eventually relented, didn't he?
Yeah, well, with the passing of time,
Right.
then we became very good friends. And so I started in the lab, and I started in the clinic, and one day I received a letter from Stan Fawn. And once again, it's kind of a repeat of the story with Mel Yar. Stan said, we're going to be in Boston for a meeting, and I would like you to be part of the Movement Disorder Society as a member of the IEC. That was the first IEC. Are you willing to come to Boston? And once again, I had to look my finances.
Right.
Got a plane ticket to Boston, arrived late at night, and they were already in a meeting. And I walked into the room, and I still remember Stan's words, I knew that Oscar would come.
How great.
And so I
Was this the organizational meeting for the society?
Yeah, for the International Executive Committee.
Yeah.
And so I became a member of the International Executive Committee in the very early days of the society. At that time, I was already a member of the International Society of Motor Disturbances, the sister society that then merged. And I started to attend those meetings, and so I got to know lots of people. And that's how it started.
Do you think, in terms of your own contributions, is there one that stands out from, not to the society, we'll talk about that, but in terms of the research that you did, or
Yeah, I think there are two things that I'm very proud of. And one now is very recent, so it cannot be historically analyzed in a perspective. But all the work we did in my lab on the interactions of different subtypes of dopaminergic receptors, I think that's been a significant contribution.
And how about the challenges along the way? Is there...
But there's another one that I think it's very important from a clinical standpoint. It was my lab that demonstrated in vivo that levodopa was not only not toxic, but it had trophic effects on the dopaminergic neurons. At that time, when there was this fight between those that supported the use of dopamine agonist and levodopa was the devil and the bad drug, we were the first to publish that levodopa was not toxic. And that led to a series of global meetings analyzing levodopa led by Eva Gide, and we published a very, very nice paper in Annals of Neurology demonstrating that. So I think these were the two major contributions.
and those were, of course, very important, as most people know. I started to ask you about challenges that you faced along the way. I mean, you were part of the mainstream even at a time when there was no internet, when you were living on the other side of the world. I assume that was obviously challenging, but is there anything that leaps to mind that was a significant challenge to your overwhelming career success?
I think that the most significant challenge was the possibility of securing funds to pursue a research career. In Argentina, that's very difficult because even though it has a long-standing tradition of neuroscience, it's not that easy to get money. But I was very fortunate. I don't know if it's coincidence or what, but another one of these serendipitous occurrences very early on in my organization of the clinical department related to PD and extrapyramidal disorders, I received a phone call. At that time, it was either mail or a phone call. And it was Nathan Sluit from the National Parkinson Foundation. And he said, "Dr. Gershanik, are you willing to receive $100,000 a year to designate your group as Center of Excellence of NPF?" And I said, $100,000, that was something that I could never fathom that I could have. And so I said, I'd gladly accept that. And for 10 years, the National Parkinson Foundation supported my clinical group and my basic science lab. So that was really another important thing.
That must have been, what year was that? Because that was the NPF.
The 90s.
I was going to say they first started branching out of Miami in the very early 90s.
That was the 90s.
So it must have been one of the early centers,
international centers of excellence. Yes.
Anything you do differently now as you look back?
No, one of the things that the second time I went to the States, I lived in Princeton, and I was absolutely marveled at this university town and seeing all the things they had. And I thought, if I had the chance early in my life to be trained in one of these Ivy League universities, maybe I could have done something better. But then I look back at my life and my career, and I'm so satisfied with the things I've done that I'm not sure that would have made a significant difference.
Is there a highlight?
A highlight in what sense?
Well, you've had a long, illustrious career. You've just finished the presidency of MDS. For me, that was a highlight.
Oh, absolutely.
And certainly knowing people around the world that are really friends. Is there anything different for you, or is it kind of the same?
It may sound presumptuous, but one of the things early on in my life, even from elementary school on, is that I always strived to be the best in what I did. It may sound presumptuous, but it was a drive I had. I needed to be the best. And this has to do perhaps with, I don't want to go into psychoanalytic or psychodynamic psychology, but compensations, I was never a good sports player. Even though I'm not Jewish, I have a Jewish last name. Mm-hmm. And that, in Argentina, at that time, there was a lot of anti-Semitism. And so that was something. And I'm short. I did not excel in anything physical. So I had the need to excel in other things. So I was the best student in elementary school. I was the best student in high school. I was the best student in medical school.
Gosh, for being so competitive, you're so incredibly nice about it.
No, the thing is, I am not competitive. I do not do the things I do to beat somebody. or to compete with somebody. It's because I'm passionate about what I do. I like it. I love what I do. And every project I undertook, it was because I loved what I was doing. So I never intended to be head of a department of neurology, but I was. I never intended to be full professor of neurology at the university, but I did. I never did anything on purpose to become the president of MDS. I enjoyed everything I did for MDS. As an IEC member, as chair of committees, as treasurer-elect, as treasurer, CSPC member, whatever. Everything they asked me, do you want to do this? I said, yes, I want to do that. So I never
So tell me, so let's just talk about that
to
for
become the president of MDS.
I'm not going to ask you who your favorite president working with was, but I will ask you, you've had a very diverse and rich career. And since we're here at the MDS, what role would you say MDS has played in your life, in your career?
A major role. It has been my home away from home. Always.
The society.
The society.
And
and the people, some of the people I consider my best friends are not in Argentina, are in the world. MDS.
Yeah, I feel the same way. So you've always been a great mentor, and people look up to you. Young people look up to you, and in this day and age, it's different than it was for us when we were sort of growing up in the 70s and 80s. What would you tell sort of a young person that wanted to emulate you, wanted to have the kind of career success that you've had? Is there
I just wrote a chapter for a book that Cindy Comella and Susan Schneider are working on kind of advice for young people. And I said that in my time, we had the disadvantage of the lack of communication. We did not have access to information in the way young people have it. But this, for young people, is also a disadvantage because they have to learn how to sort the good things from the bad things to learn what is important and what is not important. But one of the best advices I think I always give my trainees is that before becoming a good movement disorder specialist, first you have to be a good person. Second, you have to be a good doctor. Third, you have to be a good neurologist. And fourth, you get to be a good movement disorder specialist. So you have to be as comprehensive in your approach to clinical practice as possible. And being a good person is, for me, fundamental, basic. The other thing is that you have to be passionate about what you do. If you don't feel that you get a reward out of what you do, it's not possible to do things in an excellent way or in a productive way. And even though I'm very demanding with myself, I'm not as demanding as a mentor. I'm very relaxed and very helpful. I'm not a domineering person as a mentor. I just try to explain to them what are the good qualities of a good movement disorder specialist, to be an acute observer, to learn about the complexities of things that appear to be simple are not always that simple, that you have to always have a lateral thought and try to analyze things from different perspectives, never have a linear way of analyzing things. There are many, many things, and that you have to be able to learn from your mistakes and be able to recognize and decide, this is what I did and I did it wrong and I want to know why I did it, find the explanations and incorporate that into your learning process.
Well, I want to wind this down now and tell you that one of the highlights of my career has been getting to work with you over all these years, and this has been a real pleasure.
Oh, thank you.
You're a great friend.
You're a great friend, too,
Thanks.
for me. Thank you.